And we are going to move right into our first panel. John Turner is going to moderate, and our panelists for provider wellness and retention are Dr. Elise Crowninshield. She is an independent healthcare consultant, and Dr. Ramona Brooks, board certified podiatrist.
So we have a small panel, but I consider all of you part of our panel as well. So we're going to be just asking some basic questions and want your input, and so that we can help share the information. I'm with Memorial Hermann, which is a large health organization that's here in the Houston area, and we have about 25,000 employees in the greater Houston area, and I oversee the program that's called Employer Solutions. And Employer Solutions is a program that we go out to employers and work with them on what are their medical needs. So we provide physicians, nurses, on-site clinics, near-site clinics, occupational medicine, wellness programs, all sorts of things that we can go direct to the employer and work with them. We have a number of advisory boards that we do in different areas of the city to get the feedback from employers as well. So that's basically my piece. So Dr. Brooks, do you want to start first?
Sure. Well, yes, I'm Dr. Brooks, and I am a staff podiatrist, and I previously practiced in Atlanta, Georgia, and just recently came back to Texas since I'm from Texas. So now I'm in the area practicing here, and so I'm glad to be here today and to talk to you all about some provider wellness and what you can do to prevent the turnover. Because the burnout with physicians as well as nursing staff is a very serious issue and can very much so have a detriment on patient care and also your facility and your business.
Okay, and Dr. Crowninshield.
Yes, hi. I am Dr. Elsie Crowninshield. I am a healthcare consultant from Los Angeles. I have about 32 years now in healthcare. I am a nurse practitioner as well and have had a lot of nurse executive leadership responsibilities over the last 25 years. So I'm happy to be here today and offer some suggestions for your facilities.
Good. Well, we're going to jump right into some of the questions. And as it was previously discussed, there's a huge challenge with healthcare organizations and employers to retain their staff. And we know that burnout is very common. And so we wanted to, first question for you all is, do you feel like there's a direct correlation between burnout and possibly wellness, the wellness of your staff?
I'll start on that one. As a physician, definitely there is an issue with burnout, the long hours, the huge responsibility that you have with patient care and the severity of the patients that you're treating. But the balance is that you need to also keep in mind yourself. You know, you have to definitely be very protective of your personal time. If you set boundaries, then you need to make sure that people respect the boundaries that you have. Because with wellness, you need to stay healthy yourself in order to treat your patients. And once you start suffering from burnout, you can usually see a lot of symptoms of burnout where you start seeing increases in complaints. They can be very vocal, and those are what I call the town criers. You know, they let everyone know how they feel, they're upset, things like that, and then you have your silent sufferers, the ones that never tell anyone anything, and you have no idea that there's something going on until they're exiting. And that's when you find out. And that is not the time when you want to find out that there's a serious issue in your company, is when someone is leaving. So to help with wellness, like I said, provide activities where people feel like that they have resources. They feel like that they can come and ask for help and provide that environment so they don't feel like that they are incompetent or they're incapable of performing their duties for the simple fact that they're asking for help. So you want to foster that environment that they're able to come and seek out help when they need to.
Yeah, I agree. A lot of people don't share their share their stress and some of the wellness opportunities organizations can provide are EAP programs and also a lot of fun activities.
Yeah.
You know.
Yeah, I'm glad you brought that up because there are a number of things that you can do. When you think of wellness, sometimes people think only of physical wellness, but there's a lot more to wellness than just the physical aspects. And so bringing in additional fun activities or other things that you can do really helps.